Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Every first day of December each year, we celebrate World AIDS Day. This is a special day when we commemorate the efforts taken in fighting against HIV and AIDS. With me in studio are two powerful gentlemen who are leading the fight against HIV in Uganda. On my immediate left is Dr. Musingwizi Joshua, the program manager of the AIDS control program at the Ministry of Health. You're most welcome to the show, Doctor.
Thank you very much.
Yes. And on my immediate right is Dr. Byamukama Daniel, the head of HIV prevention at the Uganda AIDS Commission. You're most welcome to the show, Doctor.
Thank you.
Yes, and I am your host for the evening, Dr. Dara Sowachi. So today we are talking about HIV/AIDS and what the government is doing in fighting against HIV/AIDS. How far we have come from the past and what challenges are we currently facing and the future plans to reduce the burden of HIV and AIDS. So I'll start with Dr. Daniel Byamukama, the head of HIV prevention at the Uganda AIDS Commission. Could you tell us more about what the World AIDS Day is all about? What does it mean to the country as Uganda?
Thank you. World AIDS Day is a day we come together as a country, as a community, and as a global community. Number one, to remember the people who have lost the fight to HIV, to show solidarity with our friends, our brothers and sisters who are living with HIV, and also to rejuvenate, to rekindle our fight against HIV to make sure we end further transmission of HIV.
Okay.
So as a part of the global community, Uganda, we are celebrating World AIDS Day, as you said, on 1st of December. We expect the president to be the guest of honor. Okay. And we have a theme, which is national solidarity as we move towards ending AIDS by 2030. So we are looking at national solidarity because there are two things here involved. Number one, as individuals, there must be individual responsibility to make sure we end AIDS. But as COVID-19 has taught us, you are not safe. You don't do it for yourself alone. You don't wear a mask for yourself alone. So
it's
we must be in this together.
Okay.
Sometimes you must not transmit HIV for the sake of the others. Okay. So together, you cannot end HIV as individuals, but together we want to work in solidarity and ensure we end AIDS. And this has been 2020. Our national target is to end AIDS as a public health threat by 2030. So we have exactly 10 years to go, and we are committed. We believe we have the tools come 2030, December, to have declared the chapter of AIDS and HIV history.
Okay, so national solidarity, together we fight as a community in fighting against AIDS. Like you correctly said, it's not just an individual effort, it's an effort of everyone in their different capacities, whether they're health workers, whether they're parents, whether they're leaders, in their different roles. They all have a role to play against leading the fight against HIV. Okay, so in that regard, we represent different institutions. Dr. Joshua represents the Ministry of Health, and you represent the Uganda AIDS Commission. So the viewers may not really understand what is the relation between these two. Are they related or are they different? So maybe I'll ask Dr. Musingwizi if you could explain the role of the ministry when it comes to fighting HIV. Is it the same as that of the Uganda AIDS Commission?
Thank you very much, Darius. As my colleague Dan was indicating, World AIDS Day is a global reckoning of all of us coming together to remember the people that have been involved in this big fight against HIV and AIDS, and especially those that have passed away, and also to reinvigorate the struggle as we move the response forward. And the theme around the national solidarity, shared responsibility, is talking about bringing everybody into play to make sure that each one of us, as institutions, as the individuals, and as a country, we play our part. The HIV struggle is going to be a responsibility of each and everybody. But ultimately, the individuals, each one of them, to make sure that they play their role and protect themselves from getting infected in the first place, protecting their family, protecting their community, and protecting their country.
Okay.
Dan comes from the Uganda AIDS Commission, and as you know, Uganda AIDS Commission is responsible for coordinating the national response in this country, bringing together all the stakeholders, the government departments, the non-government departments, the civil society organizations, networks of people living with HIV, and the donors, to bring them together to agree on a national plan, strategy and plan that we implement as a country.
Okay.
At the Ministry of Health, we are responsible for implementing the public health response to the HIV and AIDS epidemic in this country. And that's the biggest part of this response.
Okay.
Within that response, we are charged with ensuring that we put in place interventions to prevent the occurrence of the disease, but also to make sure that we put in place interventions for care and treatment for those that are infected and affected.
Okay.
And all those are guided by good evidence, data, and strategic information to ensure you understand where you are with respect to the epidemic at the national level, but also at the subnational levels, and to use that information to design evidence-based interventions that you will use to address the epidemic.
Okay. So the Ministry of Health implements the response, the public health response to the HIV epidemic, while the Uganda AIDS Commission coordinates the activities, something like that, I think.
Coordinates all the stakeholders.
Coordinates the stakeholders
Yes,
involved
all of them,
in fighting the HIV.
Including those who are playing in public health roles.
Okay. So what is the public would want to know what the current situation is in the country. Is the HIV increasing? Are more people dying of the disease? What is it like? You know, we're in current COVID times, but there are still other diseases which are coming up, and HIV is still there. So the public want to know what is the current situation like. Is it getting worse? Is it getting better?
There's been a tremendous success in our response in Uganda. If you've been following our data, we have been able to put in place quite a number of prevention interventions. We have an approach that we call combination HIV prevention, where we put in place interventions for prevention. Our dogma has been the ABC, the abstinence, be faithful, and condom use.
Condom use, sir.
But beyond that, we also have other interventions that we're looking at for ensuring that we do testing and identify those individuals that are HIV infected and link them to care and treatment. But for those that are negative, to link them to prevention programs. And there are a number of prevention programs, including the ABC that I was talking about, but also ensuring that for young men, we provide them with the interventions for circumcision. We also provide interventions for prevention of mother-child transmission. That's a significant problem that we used to have in the past, which we have been able to now
mother-to-child transmission.
Mother-to-child transmission.
Okay.
But also, as I indicated, to make sure that we identify individuals that are HIV infected. We identify them, we link them to treatment, ensure that they are retained in treatment, and ensure that within treatment they are on the right treatment regimens so that we can have their viral load suppressed.
Okay.
Because as you know, when an individual is suppressed in their virus, they are not going to transmit to others.
Okay.
And we have been very successful in bringing down quite significantly the number of new infections that have been occurring in the country. You recall by around 2015, we were in a range of about 80,000 new infections every year. At the end of 2019, we had 53,000 new infections. That's still a big number, but a
still
significant decline.
It's a massive
Significant decline
reduction, yes.
from 2015.
Okay.
We have also brought down AIDS-related deaths quite significantly from a figure of about 65,000 AIDS deaths annually around 2015 to about 21,000 deaths in 2019. So there have been significant achievements. We have scaled up significantly our treatment program. We now have, out of the 1.4 million Ugandans that are living with HIV, close to about 1.25 million on ARVs. That's a big number. And
That is about, I think, close to 90%.
close to 90%
Yes.
of our population living with HIV have been tested. In the first 90%, about 89%, on treatment, that is the other 89, and then virally suppressed, the third 89. We are at around 89,
Okay.
in the treatment cascade.
That's great. So as you heard from our guest doctors, the picture is improving. We have seen a massive reduction in the number of new HIV infections occurring in Uganda. I think the figures you quoted are only Uganda.
Uganda.
Yes, so there are fewer infections occurring in the country and fewer people are dying from HIV. More people are surviving because of the easy access to antiretroviral treatment. So we're going for a short break, but after we'll come and talk about, highlight the major achievements which the government has rolled out in fighting HIV. You are hearing things like prevention strategies, combined prevention. We want to understand what exactly those are and what is the future prospect for Uganda as a nation. So join us, don't go away, we'll be right back. Send your comments, your questions on our social media platforms. We'll be right back shortly after the break.
You are watching the DOCTALK Show.